Go.
Okay. So for your Hamilton vent, the first thing you want to do is choose your circuit. If the patient is 15 or less in kilos, you would use the small circuit. If they're greater than 15 kilos, you have to use the adult circuit. The main thing with this is that you choose the appropriate exhalation valve. It's a pink valve for the less than 15, and it's a clear valve for greater than 15. The pink valve is cleaned by downstairs through sterile processing, and the clear valve is thrown away. You would set up your circuit, you would put everything on, you'd have the same, you have a pressure line, an exhalation line, everything set up, and then you would choose what you want to do. If you want to do NIPPV, you would choose first your size patient to go with your circuit, and then you would choose NIPPV, and you would put in their weight, very easily adjusted. If they're 2 kilos, you also have to confirm everything on here, and you would start ventilation. And the patient is on a PEEP of 5 and 21%.
Go.
All right, so your alarm controls are here. If you push it, it's gonna tell you what your alarms are set at, and then you can also go into even more detailed alarms depending on how your patient and anything that's going on with your patient. You always have to confirm everything with the push of this button. You can go into your controls, you can set whatever you want to set, and you just accept it. And then you go back. And then you go back, you can do your modes. This is nasal CPAP. You can do pressure control, you can do pressure support, you can do BiPAP, and you can do APRV.
Go.
So in the pressure control mode, if you want to do invasive ventilation, you would choose your baby size, you would choose your mode, which you always want to have pressure support, you would confirm it, you would go to your controls, you would set your eye time, you set with your wheel, and you would confirm it. You would set your rates with your wheel and confirm it. You would do your pressure support, your pressure, and your oxygen, and your PEEP. And you would set everything and always confirm it. And then you would start ventilation. There we go. And you will see, you will have a waveform on here and everything to see how your patient is doing if you needed to make any kind of adjustments. You have a low minute volume right now, but it's because we don't have a test lung on it. Now, if your patient was doing poorly and you wanted to change your mode of ventilation, you would have to go to standby, and then you would go to modes, and you would switch to APRV, and you would confirm it, and then you would set your T high and your T low, and you would set your P high and your P low, confirm everything, and start your ventilation. You always have to go to standby in order to change your modes.